we became very concerned about this, began looking into it, and ultimately decided that we would purchase a property in each one of the local Catholic cemeteries, which we would specifically designate as a place where women who had, and for that matter, fathers who had lost children to prematurity could come to pray, knowing that the remains of their premature child or their stillbirth, if they decided not to keep that child, was there buried in consecrated ground. And we decided what we would do is erect a statue of Our Lady holding a child at that location. And we had the bishop come out and dedicate the area specifically as a place where women could come to pray in the aftermath of the loss of a child. We coordinate our internal services through our maternity program with this location, and it's proven to be of great solace to some of those women. It's become fairly popular within our system, and so within the next week or two, another similar location is going to be dedicated at in Michigan City, in the Catholic cemetery located there by the folks who are running St. Anthony Memorial, another one of our hospitals. So it's been a kind of an eye-opening experience for us to see what a source of consolation and solace it is to the mothers and even the fathers of babies lost to prematurity and stillbirth, to know that there's a place they can go knowing that the remains of their infant are located there and buried in consecrated ground. We've only got a few minutes here, Kyle, so we're going to have to hurry. It is our tradition to memorialize our founders, as I may have mentioned to you. Our sisters came from Olpa, Germany at the call of one of the local German priests and settled in Lafayette, where within about a month or two, they established their hospital, which has been operating for 135 consecutive years. Likewise, in Hammond, they were invited by one of the local German Catholic priests to come to Hammond, Indiana. He came in February of 1898, established Lake County's first hospital. It's been operating consistently for the last 111 years. Some of those early foundresses were the victims of the big flu epidemic that came through about that time, and they are buried in the local Catholic cemetery, St. Joseph's in Hammond. And so each year, and this will be on All Souls Day, next week. No, not next week. Is it next week? November the 2nd, All Souls Day. We all go out and erect, as you can see here, wreaths over their gravestones. They are blessed, and we offer prayers for the repose of their souls as a way of memorializing our history and and their posterity. It's a great way to pay tribute to the founders of the hospital, who gave up everything, literally everything. Here is a quote, and it may have been the one you were referring to earlier, Steve, that laments what has become of Catholic hospitals, talking about how the presence of nursing order nuns in Catholic hospitals is becoming a rarity. Unremunerated care of the sick may merely parallel or even fall short of that delivered by non-religious institutions. And in fact, Catholic hospitals probably don't have a place anymore. This was a lament, a sad lament, more than a criticism that appeared in the Lineker Quarterly in August of 2001. We hope you've seen so far, or bless you, we hope you've seen so far that we're trying to uphold the tradition as best we possibly can. I should tell you that that religious order of women whose pictures you saw, whose photo you saw at the beginning, are enjoying a rejuvenation of sorts in their numbers. We happened to be at the corporate office for our leadership conference a couple of weeks ago, and the sisters were reporting that they now have 17 sisters who are either novices, postulants, or have taken their first vows. So even though their numbers are still dwindling because they can't keep up with the numbers that they're losing, they are experiencing a rather interesting increase in their numbers. Coincidentally, by a number of young women who have led very successful careers and have decided that temporal life is not for them. We have one of the young women who's just taken her first vows, I believe, is a former Fulbright scholar, which found that she just couldn't find any satisfaction in the temporal life. They seem to be drawn to not only the sisters wearing habits, traditional habits, but also to adoration. So, as I've indicated previously, I think whatever success the sisters have enjoyed has been definitely the product of that engine room, as I call it, which is generating all those graces for us. I mentioned earlier that we're very proud of our quality. St. Margaret Mercy and all of the hospitals really in the northern Indiana region are enjoying significant success from a quality perspective. Health grades, which some of you may be familiar with, ranks hospitals across the country on the basis of several years of data. All of our hospitals are receiving significant excellence awards. In St. Margaret Mercy's case, they were just awarded recognition for their cardiac surgery program, their pulmonary care program, and their women's health program. In the case of the women's health program, top 5% of the country for their outcomes. In cardiac surgery, top 10%, I believe, and in pulmonary care, I think it's also top 10% of the country. So this is repeated, fortunately, throughout the northern Indiana region, with a number of our hospitals receiving 5-star ratings. This was the coverage that we got this past week for our Respect Life service. As you can see, number of kids attending, 600, and we generally get a lot of support in the community for it, for this work, which we think does a great job of exemplifying our mission to the broader community and engendering a great deal of support. We were delighted to have so many people celebrate with us at the gala, and a number of them indicated that they're very proud of our mission and happy to be associated with it. So we think that that's kind of a cornerstone to our success. We are now in the process of trying to alert our employees to the significance of healthcare reform. What you're looking at here is a depiction of our intranet site. We put this site together last week. We invite our employees to click on this site. As you can see, it says abortion is not health care. White House congressional Democratic leaders push for votes on pro-abortion health care. So what we've done is we've invited our employees to click on this site. They can then go inside and write to their local congressmen and senators. We have letters that are already prepared if they wish, but if they want to prepare their own letters, they're welcome to do so. And we also invite them to engage in whatever other form of advocacy they think is appropriate in order to make clear what our position is regarding current health care reform packages pending before Congress. We're getting a great deal of activity out of our employees in this regard. And I think that's the end. I think we're done. So sorry, I ran through it pretty quickly, but that is, in brief, what we're doing to try and exemplify our mission. Once again, let me reiterate what I said at the beginning, and that is there is no fundamental inconsistency between exemplifying your Roman Catholic faith and adhering to the principles of your faith and temporal success. We enjoy significant financial success. We're very lucky in that regard, and we're serving all comers. As you can see, we have hospitals located in both an urban industrial area, which see huge numbers of uninsured patients, including patients for which we never receive compensation. And we're also fortunate to have some hospitals in suburban areas for whom we are properly compensated, but it is in fact a struggle, as all healthcare is today. We've enjoyed good success from the standpoint of our quality and been recognized for our quality nationally, and we don't see any fundamental incompatibility between professing our faith, as we try to do every day, and our temporal success. We encourage you to take some comfort from that and solace if necessary, and to the extent you can, encourage others to do it, because we're happy to talk to anybody. From time to time we hear from folks who want us to speak with people who don't think that's the case, and we're happy to have them come in and talk to us and show them how we do it, and show them that it can be done without too much difficulty. I wish I could tell you that this is a real struggle. Healthcare is a struggle, but we don't find any difficulty in professing our religious values, none whatsoever. We're fortunate to have good, strong leadership and a very supportive community community that understands that we're always going to be there for them, and that makes a big difference. Thank you. Appreciate it.
Catholic Health Association feature you in their publications?
No. Don't get me started.
Anybody have questions for Gene?
Please, yes.
I was just wondering if I could work on information about the St. Monica home.
I will give you my card, and if you would like to email me, then I will send you information on the St. Monica home. It's been in existence for about 12 or 13 years, I want to say. Is it that long?
I think it's longer than that.
Is it longer than that? And it has been pretty successful. There aren't very many of them left, as you know, but this is one of those programs we and the sisters very deeply believe in, and so does the staff. And so we've had to make some accommodations over time. We're now taking, we now have a relationship with the Medicaid program in the state of Indiana. They understand that we're going to adhere to the religious and ethical directives in all respects, and they're happy because they have a place where they can place young women who need help. Yes, please.
And I'm just curious, how long do mothers stay there? And you mentioned, that they, for the work to the hospital, is that after she had the baby, or how does that work?
Great questions. The time they stay depends. I'm sorry to give you such a vague answer, but depending on when they notify us and whether they're willing to comply by the conditions, and we have very specific conditions they have to meet, then they can stay through the birth of their child and for a period of time thereafter while they're getting settled. They must, if they should be in school, they must go to school. We also insist that they work. We also insist that they take the proper maternity type training that they have to take. We expect them to observe, for example, our parietal rules, et cetera, et cetera. So it's a very well-structured program designed to teach them how to be responsible, loving mothers. And so we don't really put an outer limit on it, but I'm sure that people from the St. Monica home would be shaking their heads saying, no, of course we do put a limit on it. But my recollection is that we don't put a really rigid limit on it. We try to keep them until we're sure they know what they're doing with the baby, and then, but they can't stay forever. We don't allow them to make it a permanent residence. That's for sure. Please.
I'm sorry I came in a little late. You said you have 125 doctors?
Well, we have 125 primary care physicians, but we probably have closer to about 200 total employed physicians, and those include anesthesiologists, emergency physicians. We have hospitalists, et cetera, et cetera. So we have those would be the folks who are in the primary care network.
And how many of them are NFP only?
I wish I could recruit NFP only. I have a great deal of difficulty recruiting NFP only physicians. It's a challenge. We've had a few physicians who practiced NFP who have come to work for us for a period of time and for various reasons have moved on, but we've had a great deal of difficulty recruiting NFP only physicians. In fact, in preparation for this presentation, I asked each of the presidents to tell me how many NFP only physicians were on their staffs and practicing there. And it's infinitesimally small, I'm sorry to say. Now, we have employed physicians who practice in accordance with religious and ethical directives, including, for example,